and welcome to Let's Just Do This. I'm Margaret Wallis-Duffy, and beside me is my co-host, Mr. Todd Miller.
Great to be here.
We are matching in purple today,
yes,
and excited to be here with a guest that we've had many times on Let's Just Do This, and also thrilled to be Skyping someone in today on the show as well. So we need to get started because we have a lot to get covered. So today we're going to be talking about some very interesting research that has been done with regards to your eye health and microcurrent. And with me in studio is Dr. Carolyn Teske, who has been on our show before, holistic optometrist, my optometrist, and somebody who is committed to patient-centered care and education. Welcome, Dr. Teske.
Thank you so much.
And joining us on Skype from the University of Waterloo, Dr. Ben Thompson, who is professor at the University of Waterloo, Optometry and Vision Sciences. Welcome to the show, Dr. Thompson.
Thanks for having me.
It is fantastic to have you both here and to be able to talk about something that I'm learning more and more about, a collaboration when it comes to what I do and what we can do in optometry and now in research. So Dr. Teske, let's kick off our discussion with asking, it seems sort of unlikely that a massage therapist, an optometrist, and a scientific researcher would link arms. How is that possible? And let's talk about what we've been doing.
Absolutely. It is amazing the difference that we can make when we work together. On a very long day of vision therapy training, I was away at conference and I had been exposed to microcurrent from you. I listened to Dr. Thompson speak about what he was doing in clinic and microcurrent and stimulation of the brain. And I thought, Margaret introduced me to microcurrent and what we're doing in my clinic. So the concept then was to bring research to clinic, which I don't think happens too often. So what an opportunity.
Absolutely, and I can remember actually getting that text that weekend with Dr. Teske sending me a message saying, there's a researcher talking about microcurrent and the impact it can have, and immediately I was excited, as you can imagine, Todd, to look at the possibilities. And so, Dr. Thompson, I'm really excited to have you with us. You really to let our listeners and viewers know about this research and what was the goal of the study from your perspective?
Absolutely. Well, we've been studying the use of electrical brain stimulation to recover vision for a number of years. And we've had some promising results with single applications of brain stimulation, either through electrical stimulation of the brain or using magnetic stimulation of the brain, which are two of the standard ways of using these techniques. The next question we wanted to know is whether we could induce longer lasting effects by having multiple sessions of stimulation. And this is the clinically important question. From a neuroscientific perspective, we'd shown that we could manipulate vision using these techniques. Now we wanted to know if we could treat vision disorders.
Exactly. And that's when, Dr. Teske, your years of experience and thousands of patients came into play when bringing this into clinic. So can you talk, Dr. Thompson, a little bit about what the research entailed? So what did these subjects take part in, and what were you looking for?
So in the research, we were using a technique called transcranial random noise stimulation, which is a form of electrical brain stimulation that uses a current that's rapidly changing in its amplitude over a period of time in order to try and mimic the response of neurons within the cortex. And a number of studies had shown that this technique could modulate brain activity, and we were interested to see how it would affect vision in people who have amblyopia, which is a brain-based disorder of vision. So we used the stimulation. We had two groups. Participants were randomly allocated to either receive the real stimulation or a placebo stimulation, where the stimulator was turned on. You can feel sort of a slight itching initially under the electrodes. So we duplicated that, and then we switched the stimulator off out of view of the participants. So the participants didn't know if they'd had the real stimulation or if they'd had the placebo. We made measurements of their visual acuities, their ability to see fine detail, their contrast sensitivity, how much difference between light and dark they need to be able to see. And we did this at distance and also for near measures as well. We did this over a course of 5 days. So they would come in, take a baseline measure, receive the stimulation or the placebo, and then we'd take measures afterwards. And we do that each day over a course of 5 days. We were interested in measuring whether there was a difference between the groups, both in terms of the initial effects of the stimulation, and whether those effects persisted over the course of the week.
Mm-hmm. Now, for those of you that don't understand, could you let our viewers know what is amblyopia? So what is the eye condition that you're talking about?
Absolutely. So amblyopia is a neurodevelopmental disorder of vision, and it happens when there's a difference between the two eyes during early childhood. So that difference could be the two eyes being misaligned with a squint or a strabismus, or it might be that one eye has a different focusing power to the other. Now what happens is, over time, the brain develops so that information from the eye with the weaker or misaligned image is not processed correctly within the visual cortex, and that causes a loss of vision within the affected eye. Now in childhood, amblyopia is often treated by covering the good eye and trying to allow the brain to relearn how to use the amblyopic eye. In adulthood, amblyopia is typically considered to be untreatable, and the idea is that the brain has stopped developing and it no longer has the capacity for change to relearn how to use that eye. So from a neuroscientific perspective, these studies are very interesting because it's an insight into what we can do with the adult brain in order to allow it to relearn different functions. And in the study we conducted, all the patients were in adulthood, so traditionally they would be untreatable.
Wow, and that's impressive. So really what you're referring to is neuroplasticity and retraining of the brain. So I'm on the edge of my seat, and I know you've got a limited time because you actually have to go and lecture. I want to hear what the results were of this phase of the study. Can you share with us what you have found from applying this microcurrent and what it's meant to the people in the study?
Absolutely. Well, we had two findings. So the first finding is that on the first day, the people received the stimulation. In the group that got the real treatment, there were improvements in their visual acuity, so their ability to see fine detail, and their contrast sensitivity that were larger than, and the placebo group had no change, as we would expect. So we replicated the results we'd seen before. There were improvements in vision. Now, what we found over the course of the 5 days is that effect seemed to diminish, and so the two groups came back together again. So the effect at the moment with the particular paradigm we've been using was transient. We just really see it in the first day. So this is important for us because there's two ways that we could use the stimulation. One is to use it on its own, and the other is to try and combine it with other interventions so that we open interventions. And so this study has guided us towards that second option.
So just because this happens when we're using Skype sometimes, the really important part of your discussion, which you talked about what happened and what was important, can you just reiterate that for us, because it cut out a little bit, and I want to make sure our listeners are hearing it.
Absolutely. How can you hear me now? Is that still working?
Perfect now. Yes, let's try that. Just the last part of it, talking about, what the findings showed you and what the importance of that is.
Absolutely. So we had two findings. The first is that for the first session, when people came in, there was an improvement in the group that received the real stimulation on all of our measures, and the group that received the placebo stimulation had no change, as we would expect. So that's seeing what we'd seen before and showing that it worked in a clinical setting. The second thing we found is that over the course of the 5 days, that effect seemed to get smaller. So the brain seemed to adapt to the stimulation, so that after 5 days, there wasn't a difference between the groups anymore. So we see a short-term effect, and simply having multiple sessions didn't extend the length. So there are two ways we could use the stimulation. One is to use the stimulation alone, and the other is to combine the stimulation with other types of rehabilitation techniques. And our results suggests that we need to follow that path of combining the stimulation with other techniques. So the stimulation could open a window of plasticity that we then reinforce with other types of interventions, like, for example, what's called perceptual learning, where we retrain visual functions over a period of time.
Fantastic. So collaboration is necessary in order to move this forward, but the results are promising. So Dr. Teske, as a behavioral optometrist and looking at vision therapy, does this excite you?
Oh my gosh.
Yeah, and why?
Amazing.
Yeah.
We have had the opportunity to see patients who participated in the study afterwards. And not only did that patient who did actually receive current, he improved that day, but his vision appeared to stay improved. So clinically, we are seeing, patients who have not seen with an eye for years and years and years have improvement by such a short treatment session. So really, we're really opening that door to training the brain. It's amazing.
It is amazing. And then, of course, when we open the door to further collaboration and looking at other ways to improve those results, that can be even more promising.
For sure.
Now, one of the things that you'd mentioned to me about this patient in the study is that he was actually quite surprised that he could see differently on the chart. Can you explain to our listeners why that is the case, even though you're seeing results in research, but why, because I want people to understand how the brain works, why was he so surprised to see that he had changes?
Well, in the real world, of course, you don't cover one eye and cover the other eye and stare at a chart, but the eyes get a picture, yet the brain does the processing and gives you vision, right? So for us to train the brain to improve his vision is almost backwards to what he normally would do, right? So he would just get the picture from his eye, and for patients with amblyopia, their brain suppresses the image that is not clear, right? So we're removing that suppression, or essentially teaching the brain to use an eye that they have learned to ignore. So cool.
Right, so cool. And his response was quite exciting in clinic.
Absolutely.
Yeah. So before you have to go, Dr. Thompson, can you just speak to, what may be in the future? Are you looking to continue this research? And if so, what can we expect?
Absolutely. Well, we have two studies planned. So the next study, now that we've seen these effects in a clinical situation, is to try and understand exactly what's happening in the brain. So we're going to be using measurements of brain activity, using electrical recordings from the surface of the scalp, and see how those recordings change before and after the stimulation, so we can understand the time course of the effects and what's happening within the brain. And I think these findings point us towards a combination of the brain stimulation with a perceptual learning or visual training type paradigm. So that will be the next step as part of this collaboration, moving our basic science and neuroscientific research into a clinical environment.
That's what fires me up and why we are so excited to have you on Let's Just Do This. Making inroads by working together, using science to support it, but empowering patients to have options to consider when it comes to their health is really why we're here. Thank you so much for taking time out of your busy schedule. I know you've got a lecture to do and you need to get going. So thank you for joining us, and I'm sure I'd love to have you back on the show, maybe with the results of the next aspect of the research that's going to be conducted, so we can continue to share, educate, and empower.
Absolutely. Thanks very much for having me on.
Thank you. Stay with us, because we've got more here with Dr. Teske in studio. We're going to talk about what's next and how this massage therapist and optometrist are linking arms to give you options for consideration, because we know that the eyes are a window to your health. Stay tuned.
Welcome back to Let's Just Do This. I'm Todd Miller, along with Margaret Wallis-Duffy and Dr. Carolyn Teske. And we were talking to Dr. Ben Thompson about next steps. And he mentioned vision therapy to make the microcurrent more effective. I see you as a leader in that field because you are embracing both. You're an expert in vision therapy. What are the next steps? Can you speak to those? How would you take the study and go forward yourself?
Absolutely. It's so exciting for me, Todd, to be involved in both sides, right? To bring research to clinic, to see results from research in clinic, because we don't work at the same pace, right? Research works at snail's pace and clinic is flying, but to put the two together. So to be able to say with certainty from a research perspective that we can train the brain, and we did, that's the first step. But it fast forwards patients to a place where then we can really train the brain, which, years ago we would say, sorry, there's nothing we can do. So all of these potential candidate patients who have never really seen with an eye now potentially are going to have two eyes working together.
And research, I guess, is really generally skewed to future generations, whereas you're dealing with the patient now that you would hope to be able to assist them now.
Absolutely.
And not in years.
All of the patients in the study were real life people that actually are current patients in my practice, so it was awesome.
And what I love about this study and putting it into practice in your clinic, you also have vision therapy in your optometry practice, which is not offered everywhere. This is a new thing that is being used, and you're seeing phenomenal results. Let's talk a little bit about the role that vision therapy can play, and why microcurrent can even enhance the results of vision therapy and ultimately the results that this patient is going to feel, because at the end of the day, that's what matters the most, is how is it going to impact the health and the day-to-day living of the people that we're treating.
For sure. So I think, the possibilities are endless, right? There is so much that depends on whether or not the brain is actually getting the right message, and then what the brain does with it. Often in vision therapy, we're involved with learning disabilities or concussion or headache or stroke. Amblyopia is only one of the patients that we treat. But if we know we are successfully training the brain with amblyopia, then we know we're also having effects with all of those other conditions.
So for those that are listening at home that A, probably can't pronounce amblyopia, but B, are wondering, what is that? Can you please clarify that for us?
Absolutely. It's like a second language for us, right? We forget. So amblyopia probably most commonly is called lazy eye. Now, lazy eye can really mean two things. It can mean an eye that turns and wanders, or it can mean an eye that is working so hard. In fact, that both eyes are working so hard that the brain says, you know what, I'm not going to use that one, let's just let it sleep, and I'll focus all my attention on the other. So a lazy eye can be because there's poor focus or poor vision in one or both eyes, or because muscles are weak and the eye's wandering.
Right, and that's where vision therapy plays such an incredible role in helping to retrain that. Now, vision therapy can be a long process, and
Absolutely.
And there is an investment of cost and time and money, which can sometimes be a barrier to access. Now, as a massage therapist, and we've said this on Let's Just Do This, and with our Better Together movement, it's not typical to see a massage therapist inside the walls of an optometry office, but we're all about breaking down the silos and really working together collaboratively and putting the patient at the center. One of the things that I've had the honor of doing inside the walls of your clinic, Dr. Teske, is providing microcurrent point stimulation therapy. So when we embarked on doing this study with the University of Waterloo, I was very, very excited, but we were using, I want to speak to the type of current and the application of the current that we've used in the study and what we're hoping to do in the future. And then we can talk about what this incredible device is that I have here in my hand, and how it can apply to eye health.
For sure. So the application of the current in the study was with a pad. So literally, a discus through the skull to the brain. I think you can, certainly explain your experience with applying current at different strategic spots, and that's what we're doing.
Absolutely.
And you're doing in clinic.
Yeah, so what I love about the next steps in the next study, and we're already in conversations with the researcher to do this, is to now take what we've already learned with the first study and got results with, but we truly believe that by using a device like this, which is called microcurrent point stimulation therapy, this is taking needleless acupuncture and combining it with microcurrent, direct current. Unlike you would have in a TENS machine, which is alternating current, this is direct current, which was in the study. It was direct current. However, the very interesting thing with this device is that we're using well-documented research in acupuncture points to apply the microcurrent in very specific regions, both locally, so right at the visual cortex, and distally, because this also works on our nervous system and fascia. And we know that when we've had issues in terms of our fascial system somewhere else in the body, when we're looking at meridians and acupuncture points, what happens potentially in your abdomen can be affecting your eye, or what's happening in your eye can be affecting your knee, because we are all connected. So this device is going to enable us to really focus on certain areas of the brain to get the outcomes that we hopefully want to see. And we're going to take it one step further, hopefully, and be able to actually look at the distal points in acupuncture that we could apply the current and still see changes in the eye. Now that excites me as a massage therapist and as a practitioner that's trained to do this. And we are seeing results already in your clinic, aren't we, Dr. Teske?
Oh, absolutely. With nerve palsies, and it only makes sense to me as a science basis kind of person that if we got results going through the skull, through the skin, with a pad, that when you strategically put it, in an acupuncture point where we're going to get the least amount of resistance, our results should be just that much better.
Absolutely. So let's talk a little bit about vision therapy and microcurrent and how the two can play well together. One of the things that excites me, once again, we always talk about access to care. What I love the concept of is us partnering and linking arms so that potentially I could start treating a person that may have suffered with a concussion, or maybe they're post-stroke, or a head injury of some sort, or maybe it's a child with learning difficulties. And I'm going to treat them first with microcurrent to set them up for success, and then pass them along to vision therapy. Can you speak to why that could and should shorten the course of treatment necessary through vision therapy because we've collaborated?
Exactly. If we fast forward the amount of work that the brain's going to need to be rehabilitated, which is essentially what we're doing with microcurrent, then the extra work, going that next step where you just have to get past the block, will be that much easier. When we're doing vision therapy, not only is it time consuming, but it also requires a lot of participation and willingness from the patient. Right? So they've got to do their homework. And we don't always get that. But if we can show that patient initially, look, you're getting better, then they're going to be that much more motivated, Absolutely. Right, to continue and to do the necessary exercises and homework that's required.
Absolutely. And the other thing I love about what you're saying is not only does it help to show the patient that it's helping, but we can also, they're taking exercises home to be doing for vision therapy. The very cool thing, this device is Health Canada and FDA approved for over-the-counter use with patients. And with working alongside professionals like you and I, we can help educate the patient with proper protocols to be using this at home every day, which can speak to what Dr. Thompson was saying earlier about longevity and having the effects last longer. Well, if they can have an impact on their nervous system on a daily basis and help to retrain that brain daily, can you imagine the results and how not only will it speed it up, but perhaps how it will last longer?
For sure.
And impact so many other facets of their life. I mean, I own one. I know how well it works.
No question, no question. There's been lots of great science and research on microcurrent point stimulation therapy, this in particular. And of course, if you want more information about that, we will put it in our show notes, and we will make sure we can share some links to the research and to my mentor, our mentor, Kelly Armstrong, who is a brilliant woman who is working tirelessly to link arms with conventional medical community, to do research, and to really see the power that this device holds for so many things. So Dr. Teske, as an optometrist, and now you've opened the doors to a massage therapist in your setting, one of the things I love about the work that you do is that you really look at the eyes as a window to your overall health. When you think about the role of microcurrent, can you please speak to not just with this research, but how you approach a patient in your chair each and every day when they're just coming to get their eyes checked? Why are you so motivated to go above and beyond and teach them all kinds of other options for consideration that really a typical optometrist doesn't do? Why?
Well, thank you. Everybody has a story, and I think, my story is I believe that we deserve to be well till whatever number we are here till. And I am driven to be riding a bike or, golfing or doing whatever it is that I want to do at 95. But, all of us agree, I think, in order to get to that stage, you have to be a participant in your health. And not only do eyes need to be working and vision needs to be good, but your entire body needs to be well. And for that to happen, you have to be at the center of your care, surrounded by everyone supporting you, right? Which is what our Better Together movement is all about.
Absolutely. Now, I understand that there was some talk about a person, and we won't name who it is, but in your life, Todd, we've only got a couple of minutes, and I thought it'd be kind of fun to share a bit of a story, how it ties in with eye health. Do you have something to share about pool?
A certain person in my life has claimed that maybe their vision isn't the best and it impacts their pool playing. And you did mention before we started the show that that vision therapy can also help your golf game. So I'm thinking there's a new secondary market in here for those wanting to improve.
Yeah, their performance.
Absolutely.
Sports performance.
Sports performance and vision enhancement, this is real. It's happening everywhere at the moment. But, imagine if your eyes are not getting the same picture at the same time, then any kind of sports that we're playing, including pool, will be improved and enhanced if your two eyes are working together.
It's hand-eye coordination, it's angles, there's so many variables. But
so your whole body is involved,
yes.
right?
Indeed,
Which is,
indeed. Well, we continue to ask you to come back to be on the show because you're constantly doing new things and looking for new collaborations and contributing to this whole Better Together movement. So thank you for joining us. I know we're going to have you back on because we're going to talk about the next research project that we're working on together and sharing those results too. So thank you so much for coming in studio today and joining us.
My pleasure. It's a privilege, always.
Thank you.
Thank you.
Well, Todd, another episode of Let's Just Do This coming to an end.
In the books.
In the books, indeed. And of course, we always want to ensure that you're reaching out to us, that you're letting us know what you think and how you feel. If you feel so inclined, follow us in all of the social media platforms. Make sure you share the information that you're learning because we are better together. We are committed at Let's Just Do This and through our Better Together movement that we're going to help to educate, empower, and inspire you to live well through all the education that we're sharing, but we need your help to do that. If you want to be the CEO of your health, we are here to help you do that. That's what this show is about. So until next time, pay attention to what you're doing in your life. Reach out to those that can help, perhaps some of the people that have been on our show, and engage with us so we know what you need for us to be able to help you. So until next time, from all of us here at Let's Just Do This, be well.